Hi, everybody. My name is Melissa. I'm here from AIM at Melanoma. We are coming to you live tonight to talk about the coronavirus or COVID-19. We as an organization thought it was really important to do a Facebook Live about this, given that it's so very prevalent right now. We find that, or I find that I'm getting a lot of questions in regular practice. I know that this is on the forefront of everybody's brain everywhere, worldwide. So what I wanted to do first is just kind of explain what we're going to do tonight. So my goal of this Facebook Live right now is to make sure that we are educating our listeners with the very most accurate and factual information about the virus that we know. So a lot of this information is actually from the World Health Organization and the CDC because, you know, they're the experts. They're really the people that are driving the information in this really tough time. And I know from preparing for the lecture and from just, you know, listening to the news and to CNN and other places that just really there's a lot of information out there that unfortunately either isn't exactly accurate or has gotten kind of twisted in a certain way. So what we really want to do is make sure that as a melanoma community, we are educated, because then we can understand what this virus is about. We can understand what it means for us as a group. We can understand why we're doing the things that we're doing and why some people are recommending certain social distancing practices that are happening in some of the, you know, states. So that's really my goal. I also ask, and I know that it was posted earlier on Facebook today, that you really save your questions for the end of this Facebook Live, just because, number one, I don't want to miss anything, but also so that we can make sure that we get through all of the information in a timely manner, and I can spend the rest of the time really trying to address the concerns that you have as listeners. I also wanted to mention that I'm going to very much try to make the questions, answers to your questions as general as possible. So I ask that you don't post or don't ask questions that are specific to your specific disease. Personally, if that's something that you want to ask outside of this forum, certainly you can reach me at the Ask an Expert hotline or by sending an email via the website. So let's just make sure, that we try to, be mindful of that. So let's just start from the beginning here. So what is a coronavirus? Coronaviruses are actually a large family of viruses that already exist. They exist and are very common in people. But they also are common in species of animals such as cattle, cats, and bats, and other types of animals. There have been rarely, now and in the past, cases where the animal coronaviruses are able to infect people and then spread person to person. And that is actually what has happened with COVID-19. It actually was thought to originate back in December in China. It was thought to possibly have originated from bats and then mutated into another animal and eventually infected the first human. So there have been other coronaviruses in the past. The ones that are most familiar are Sars and Mers. And just to kind of give you an idea as to how contagious or virulent this new coronavirus is, SARS had about 8,000 cases when everything was said and done. MERS had about 2,400 cases. And COVID-19, which is, still in its spreading phase across the country and worldwide, has hundreds of thousands of cases. So, as you know, this is a very serious problem, not only for our local communities, but also worldwide. How does it spread? It's contained within droplets. So the virus actually is contained in droplets, just like the flu vaccine. So it spreads by people coughing and sneezing, primarily. So, when you sneeze or you cough, you release mucus, sometimes little tiny particles of water that actually contain the virus in them. If you happen to be standing next to someone when this cough or sneeze happens, it is possible that you could breathe in these droplets. It's sort of why they have this sort of distance. You want to stay within, 3 to 6 feet from someone right now when you're in a public place, just so that if they do happen to cough and sneeze and don't have a full elbow cover, that you don't accidentally inhale those droplets. Also, if someone coughs or sneezes in their hand or without covering and those droplets land on a surface, or they do cough in their hand and they touch surfaces, that virus then is passed to whatever surface is contaminated with the droplets. There's a very small risk that the virus could spread through feces, but that is an extremely low risk, and it goes back to something we're going to touch on multiple times in this talk, that you really need to wash your hands. And so really, for the purpose of droplet-containing viruses, really hand washing and disinfecting surfaces is your best mode of protecting yourself. And I will say that probably 20 times throughout the course of this Facebook Live. There was some panic about asymptomatic spread. At this time, the CDC thinks that the actual risk of that is extremely low, not only from the fact that if you're asymptomatic, you're not coughing and sneezing your droplets everywhere, but also the viral load during that time period, during the incubation period, where you are infected with the virus but you're not showing symptoms, is extremely low. So the whole idea of there's hundreds of people walking around with a virus that can be spreading it without symptoms is very low on the. It's very unlikely that would occur. But again, this is why the social distancing idea is extremely important. I did touch on this already, but the incubation period for the COVID-19 is around 1 to 14 days. There have been reports of people that have incubated a lot longer. There are shorter incubation periods from the time you're infected to when you show symptoms, but for the most part, it's within the first 14 days of exposure. The average is about 5 days. This is also why they are asking people to quarantine themselves, to self-quarantine themselves, not only if they're infected, but also if you have been exposed to someone that has had COVID-19, to really be careful to stay away from people for that 14 days. What is the exposure risk? I already told you that this is something that is like 20 times more virulent than SARS. And I remember being in, years ago being terrified of SARS, and this is much more virulent. However, the exposure risk is sort of related to how many people in your local environment are infected. So, the immediate risk is pretty low in areas where there are not widespread cases. Like, I think West Virginia has 1 case in the entire state of West Virginia as of last night. Now, again, today that probably changed, but as of last night, West Virginia finally got their first case. So the immediate risk for people in West Virginia is quite low. However, the exposure risk in community is where there are a lot of infected people, like right now, Washington, parts of Florida, parts of California, Massachusetts, where there are a lot of reported confirmed cases, your risk is much more high. Healthcare workers have a really high risk for patients that do have COVID-19. So less so in, offices where COVID-19 patients are not presenting, but the folks that are actually taking care of those people that are in the hospital with the confirmed virus have a very high risk of spread. And they're actually doing what are called droplet precautions. So it's goggles, a mask, chemo gowns or gowns, gloves, just to prevent those droplets from getting on their body where it could, enter. You can be exposed to someone that you're living with. And so part of this is why things like dorms, why like college kids were sent home, and in assisted living facilities and group homes, it can spread pretty quickly through those types of areas where you share close space. We've also seen a lot of exposure and cases from travelers returning from, Europe and Asia and places that were infected across the sea and came back to the United States. But now we're seeing also some travelers coming from places that were affected. So like people that were in Disney World in Florida before it was canceled and traveled back home, just as an example. Or folks that had been in, states that are heavily infected and then travel home to their home state and have infected the people that they came in the area. So again, this is something that unfortunately is spreading pretty quickly. What we don't want is for everyone to panic because, for the most part, the majority of the population, even if they are infected with this virus, will have very mild symptoms. And we'll talk about that in a little bit. And so all of the really, practices that are being performed right now are not only to protect the people that are at risk for the most serious complications, but also to help us not overwhelm the healthcare system. So really the goals and the risk exposures are to help those specific things. Having an older age seems to be the most compelling risk factor for serious complications of this virus. Like when you look at the mortality rate and complication rate for folks that are infected, it seems like there's a very big jump in complications at age 60. As your age goes up, that risk exponentially increases. So the highest risk for complication are really folks that are like in their 80s. And so we're really, older age seems to be the most compelling risk factor for complications. Now that doesn't mean that if you're 40 and 30 years old, that you're not going to have complications of this virus. That can still happen. It's just that it's less likely. Folks that are truly immunocompromised have a higher risk of complications. Now, there's some not necessarily confusion, but folks that have cancer, and especially like melanoma patients. So if you've had a stage 0, 1, 2, 3 melanoma in the past, it's been treated, your risk of serious complications really is not really any higher than the general population. I've spoken to several of our melanoma experts, not only at our institution, but across the country. And that is the general consensus that, folks that have had a melanoma in the past aren't necessarily at a greater risk than what you would be without a melanoma. When they're talking about immunocompromised hosts, they're truly talking about folks that are on active chemotherapy or radiation. Now with melanoma, we use immunotherapy and targeted therapy for the most part. And so those things do not increase your risk of being immunocompromised. They're talking about folks that have blood cancers. When you have a blood cancer, you are not able to fully engage the immune system because those cancer cells are actually crowding and taking the place of the blood cells that are responsible for helping us fight infection. So folks with blood cancers, people that have had bone marrow transplants, and also folks that are on immunosuppressive drugs, like anti-rejection medications, drugs that actually do suppress the immune system, like high doses of steroids. Those people are who they're talking about when they're talking about immunocompromised folks. Also other comorbid conditions. Now, lung disease, think like COPD, because this is a respiratory virus that affects the lungs. If you have a lung condition, it makes you, less likely or less able to really adapt and cope with the virus and the changes that occur in the lung. The same applies for chronic heart conditions, things like diabetes that do not allow you easily to recover from infections, chronic kidney disease, because when your lungs aren't properly functioning, you really rely heavily on your kidneys to really make up the slack and really get rid of those bad chemicals that you need to exchange. And so when the lungs are affected, if you have good kidneys, a lot of times things are much easier to recover. But if your kidneys are not good, that can really complicate the whole process of healing. So just to get those things clear, those are the people that are at risk of serious complications. Now, am I at risk with melanoma? Well, everyone's at risk, to be honest. Everyone has a risk of getting this virus. And although these people, the groups that we just talked about, are at the most serious risk of developing complication, everyone is. But generally speaking, melanoma patients are not at more risk than the general population if none of those previous things apply to you. Okay? Melanoma patients are not generally immunocompromised, because being immunocompromised means that you have a less than normal functioning immune system because of a significant change in especially your white blood cells. Some melanoma folks do see a small dip in the function of their immune system with stage 4 disease, and especially folks that have a really high burden of lung tumors. And that would also be something that would make you a little bit more prone to complications if you are a patient that has stage 4 melanoma that has a lot of disease in the lung. Obviously, that would make the reserve healthy lung a lot less prevalent. And so that could affect your recovery. So again, while melanoma does not make you immunocompromised, other things that we just talked about can make you at risk for serious complications or complicate your illness if you do get infected. But this is true for the general population as well. There are some special circumstances in melanoma that would make you less able to fight an infection. And those things are being on high-dose steroids from an adverse event that happened from your immunotherapy, like hepatitis, colitis, something like that. So when those things happen as a result of treatment and we put folks on really high doses of steroids, that certainly could cause you to be less likely to be able to have a great immune response to fight this. If you are on medications for long-term or steroid refractory adverse events, like if the high-dose steroids didn't work and we put you on something like Remicade, or it's also called infliximab, those types of medications can sometimes lower your immune system as well. If you have melanoma in the bone marrow, that can certainly affect or make you more prone to infections. Folks that have a very, very significant tumor burden, so like hospice patients, at end of life, will be more prone to not being able to cope with this as well. Or if you're on high-dose steroids for another reason not related to any of this. But ultimately, with all of this information that I just spewed out, if you have a question specifically about you, and if you think that you might be immunocompromised, the best thing to do is ask your healthcare provider. They know your case. They're much more knowledgeable about the other comorbidities that you may have, where your disease is, and all of that. So you really should ask your healthcare provider. If you are truly worried after hearing all of that information, just ask. You can call me and ask. We'll have to ask you a bunch of questions, but we can certainly try to determine, if you are at one of those risk populations. Other things that you might be worried about making you more at risk, but don't actually make you more at risk, are having a completion node dissection. When they do completion node dissections, especially nowadays, they really remove a minimal amount of lymph nodes. It's not like it was before, or even for other cancers such as breast cancer. They really are moving between at most 15 lymph nodes. You have hundreds of thousands of lymph nodes in your body, and really, aside from immediately post-operatively, like the first 1 to 2 weeks, and that's mainly from your body being stressed from the surgery and needing to heal, your immune system is quite fine. Being on immunotherapy does not make you immunocompromised. There's actually some folks that think that when you're on immunotherapy, you actually are at an advantage because your immune system is extremely engaged, which is also why it causes some of those adverse events. Being on targeted therapy like the BRAF MEK inhibitors also does not increase your risk of complications or make you immunocompromised. And also having specific stereotactic radiosurgery. So when they do the extremely focused radiation on things like brain metastases or bone disease, because it's really just one dose. Your body recovers from that pretty quickly, and it doesn't seem to impact or make you more immunocompromised as well. So hopefully that answers all of the questions about, am I at risk or am I immunocompromised? Because we get that question all the time, not only in our clinic, but on the Ask an Expert line. So I hope that helped with that. Nicole, I can see your question. I know I was not going to address this, but high dose steroids would be like immunosuppressive doses. So anything over like 40 milligrams of steroids a day would be immunosuppressant. Just so that we kind of have an idea as to what high dose steroids are. The symptoms of coronavirus are pretty known, I think, at this point, but it's really fever and dry cough. If you are developing shortness of breath, really that's a sign that you should be headed to the hospital for help. What the CDC actually knows now is that folks that are short of breath with the other two symptoms and that are confirmed to be positive for coronavirus actually decline very quickly once that shortness of breath starts. And so the CDC and the World Health Organization has kind of used that as a benchmark for the folks that they're, trying to let be at home with, mild symptoms like fever and dry cough. They're going to, in most cases, unless you have a compelling reason, they're going to tell you to go home and self-quarantine. Don't come to the hospital. Most people that have the dry cough and the fever will recover without treatment. There are some folks that also get some additional constitutional symptoms like muscle aches, runny noses, things like that. But for the most part, the most common symptoms are fever and dry cough. There will be people that will die from this virus, but most people, 80% of people, will recover, some of those without any symptoms at all. What do you do when you do treatment? So because 80% of the people, or that's the statistics that we know right now, are asymptomatic or have very mild symptoms, the treatment is really geared towards supportive care, kind of exactly like when you have the flu. So increase your fluids, use Tylenol for fevers and pain, rest as much as possible, self-quarantine. That's part of the whole social distancing thing, because you don't want to infect other people, because once you have symptoms, your viral load is extremely high and you can pass it to lots and lots of folks. They're really trying to save hospital space for when it's really needed. So again, if you have shortness of breath, go to the hospital. If you're short of breath, most likely your oxygen saturation is decreased. And those folks, at least from the CDC and what they know, both in China and Italy and already in the United States, once that happens, you really do need medical attention and more serious support. So now we know all that. What we really need to know is, how do we protect ourselves? Because at some point or another, probably the majority of people watching this, or people that are gonna get infected. So just like with the flu with the flu virus, hand washing. For things that are spread through droplet particle, hand washing is one of the most important things that you can do to protect yourself. Soap and water is really effective. So, and they're actually seeing that soap destroys the membrane of the virus. And so you're literally destroy. And when you rinse your hands, you're washing the virus away. Alcohol-based hand sanitizers are also able to be used. They really should have an alcohol level of above 60% to be effective. Good luck finding hand sanitizer though. So really soap and water are your friends. When you use hand sanitizer, you still have to get it in all your cracks and things like that. The alcohol actually does destroy the virus as well. But when you think about it, soap and water, you're washing it, you're killing it, and you're getting rid of it. It's not on your hands anymore. So wash your hands. Wash your hands more than you think you need to. Very literally, I wash my hands probably 50 times a day. Now, granted, I'm washing them twice for every patient that I see. But let's say on a day that I'm home, I wake up, I wash my hands before I put my contacts in. Obviously, you wash your hands after you go to the restroom. Wash your hands before you eat. If you're bringing stuff home from the grocery store, wash your hands. Really, you can't wash your hands too much. Avoid touching your face, like your eyes, your nose, and your mouth. It's called the T-zone. You've probably seen me scratch my nose. I really want to wash my hands right now. I'm not going to lie. But those are the things that you want to avoid. So, wash your hands, don't touch your face, because that's how the viruses enter your body. One of the other things that I heard kind of as, oh, you should do this, and it actually makes a lot of sense. Drink lots of water, because truly, if you're keeping your throat and mouth nice and wet and not dry, it's much harder for things to stick to you. And a healthy mouth is a wet mouth. So please continue to drink tons of water during this process. It's one of the things that you can do for yourself to keep your immune system healthy. One of the defense mechanisms against inhaled bacteria and viruses is actually swallowing and saliva. So truly drink water. It's good for you. When you cough and sneeze, if you are infected or you're not, and really this is just general hygiene, cover with your elbow. You can't kind of do it from out here. It doesn't work if you're like this. Actually, get your elbow close to your face. If you forget and sneeze into your hand, wash your hands. We also are practicing social distancing. So what that means is no hugging or shaking hands to our fellow Americans or people. I'm a hugger. This is hard for me. I think I hug every single patient that I see. So, really that close contact, if someone would happen to sneeze while you're hugging them or you're touching their hand with your hand and then you touch your face, guess what? You infected yourself with whatever they have. And avoid travel to hotspots. This is important not only to places internationally, but now it's important to places within the United States as well. And a lot of businesses have actually limited their travel to places because they want to limit and really quarantine this into local problems. Should I wear a mask? This is something that we get asked all the time. So in reality, the masks that they sell commercially that most people are familiar with don't protect you against small droplets. They can only be used once. Once they're wet, they're ineffective. So you wear a mask, you throw it away. Repeatedly wearing a mask doesn't protect you. And again, the masks that they make that you can buy commercially that you don't need fitted for, that they go over your ears, they really are not, they're good for large particles or large droplets, but they're not good in this particular instance for COVID-19. They're better than nothing. And really what they're saying is that we really should be saving those masks for healthcare providers that are caring for folks that have the coronavirus. In the absence of the special N95 respirator masks, you have to be specially fitted for those. There's a huge shortage of them right now, just because of the need with patients infected. So really we need to save those masks for people that need them. It doesn't protect you from the virus by wearing them out in public. You can use a mask again if you're infected, especially if you're going out in public or if you're around your family, to try to avoid spreading it to them. We really need to rationally use the masks that we have, because it's a critical resource that may protect someone, in your family if you are infected, but also especially the people that are taking care of you in the hospital. So social distancing, what is this? Truly, social distancing is intended to flatten the curve. What does that mean? The way that a virus is spreading right now is an exponential growth curve. It's almost doubling. Like, we're watching it just speed out of control at this point. What happens, unfortunately, is like 2 weeks into this infection, we can overwhelm the healthcare system. We really need to not do that. And the reason is, and the way that this is a really bad example, but also a really good example. So at least around here, as soon as this kind of broke in the United States and things were spreading, everyone went out and bought toilet paper for reasons that are still not clear to me. But no matter what store you go to, you can't find toilet paper anywhere. People were just hoarding toilet paper. And so in this analogy, the toilet paper are ventilators. So if everyone gets sick at the same time, there's not going to be enough ventilators for everyone to take care of them for the people that need them. I know that, a lot of folks have been admitted to the hospital. You know how difficult it sometimes is to get a bed in a hospital for regular circumstances. For folks that have the coronavirus, they really need a lot of times very specialized, isolated care, and sometimes ventilator support. You can't buy a ventilator. Like, it's not an unlimited supply. You can't produce it and buy it if we run out. So truly, what we're trying to do, and this outbreak may last a little bit longer, but if we are able to not overwhelm the healthcare system and make less people become infected at the same time, then what their CDC hopes is that they're able to take care of these people more, properly and prevent deaths that they're seeing in places that got overwhelmed right away. And so we're learning from things that happened in Italy and China and trying to prevent that. So social distancing is extremely important. In my opinion, it should be practiced everywhere. What does that mean? Keeping 6 feet between you and the next person if possible. Stay home. Right now, a lot of states are actually asking their residents to not go out in public, to not spend time for non-essential things outside of their house, avoid social gatherings, avoid crowds. The president had said 10 people, but really stay with your immediate family unless you have to go to work, truly. No non-essential travel. Don't make the trip to Florida right now to have spring break. It's really not worth it. Cruises, traveling between cities and states right now, they're asking folks to really stay home, because if you go somewhere and get infected with the coronavirus and bring it back, then you're spreading it in your local environment, and that spread is going to overwhelm your local community. Minimize trips to the grocery store. Don't go every day. Like, I used to grocery shop once a week, and I tried to go and buy enough food to last me for 2 weeks so that we could really try and stay home. And limit your visitors. Like, a lot of kids are off school right now. And so part of social distancing is not having play dates and going to the bar. Those things are really not what we're trying to do. Social distancing only works if people listen and everyone participates. So we're not social distancing for the people that won't have symptoms. We're social distancing for the folks that are really at risk. For someone like my dad, who had a bone marrow transplant last year, I'm scared for him. And so, I want to do everything I possibly can. And I'm trying so hard to stay away from anybody that I can outside of work, because I don't want to infect him by accident. There's actually an initiative called #StayHomeSaveLives. But we need to make a radical change in the growth curve for this virus. So if you have more questions on social distancing, I'm happy to address those. There's actually websites about what you can do and really what the definition of social distancing is. If we do this right, it seems like a giant overreaction, but truly it's very, very important. Should I avoid going to my treatments and appointments? Now, some larger academic centers have actually made recommendations about this finally, where if you are a person who had a melanoma 6 years ago and it was an early stage and you're going for like your routine check, they're saying postpone it 6 months. Really non-essential appointments we could probably avoid. If you were just recently diagnosed or you have active treatment, really we're encouraging folks to still go and get your treatment. It's important. A lot of places are taking extraordinary measures to help keep you safe. We just went over how you can play your own role in keeping yourself safe. But really continue to get your treatments if you can. A lot of that is going to be dependent on what your local government is telling you to do and whether or not you are able to go. if there are restrictions. I know a lot of our folks go to community hospitals, and so they very much might be not able to get their treatment. But if you can, you should go. If you're due for scans and you have active disease, you should try to go. But really, if you have questions about this, you should ask your healthcare provider. If you're having symptoms of COVID-19, if you have a fever and cough, you should stay home. There was a person who actually had asked a question of like, how do we tell the difference between pneumonitis? I'm getting dry, sorry. Between pneumonitis and COVID-19. Because actually the symptoms of pneumonitis are dry cough and sometimes shortness of breath. One, there would be no fever, first of all. And two, excuse me, I need to get a drink. I'll be right back. Give me 1 second. Okay. Sorry, this is a long Facebook Live. And truly, that's something that your healthcare provider should help you decide. So if you're a melanoma patient, you're on treatment, you get cough with or without fever, you should probably call your healthcare provider. What if a family member gets sick? So if you're not the person that's sick, but someone in your family is sick, again, wash your hands as much as you possibly can. If possible, have the person that's sick kind of in their own bedroom, use their own bathroom if that's possible. If it's not possible, clean the bathroom with the disinfectant things after it's used by the sick person. There's actually a really good resource on the CDC's website about what types of disinfectants are effective, how to make bleach mixtures, things like that. If you do have someone in your home that is actually sick with the coronavirus, have the sick family member wear a disposable face mask if possible. And again, those are one use only. You have to throw them away once they get kind of wet from breathing. Don't share personal items with them like utensils, food, drinks. That kind of hopefully is common sense. Disinfect like light switches, doorknobs, things that they routinely touch, like the handle on your microwave and refrigerator, like high traffic areas. Some places are also asking that the contacts self-quarantine somewhere else. That's not always possible. I don't have a vacation home that I can send someone in my family to self-quarantine. So really trying to isolate them to a specific area as much as possible, keeping that 6-foot distance between your family members is really all you can do. This kind of came up in the context of like what I should do if a family member is sick, or what if I'm, at a place where someone is sick. The virus can survive on surfaces for hours to several days if they're not cleaned. And so that's another reason why, like, don't touch things and then touch your eye. Don't touch things and not wash your hands. This is especially true, and they're saying like things like grocery stores. If you can wipe off things like cans and stuff like that, you probably should. We don't know how long it's been on the shelf, it literally could have just gotten there. If you're really being precautious, you certainly can wipe off things like that. You don't necessarily have to wipe off things like cardboard boxes. There was a question like, can I get stuff through the mail still? Is that a risk? Most of the time, things that come from like Amazon are not going to, the virus isn't going to stay active on cardboard for that long. And I know that like every company in the world is taking precautions for things at this time. So again, hand washing is going to be extremely important in this setting. Okay, so one of the other questions that came up quite a bit, and we have a big list of them, so we're gonna start from the beginning. I know that you guys have 100,000 questions. I'm done presenting all the things that I have, so I'm gonna try to answer as many questions as I can. I'm gonna start with, we're just gonna kind of scroll on the screen and try to answer them. Pauline, if you have scans scheduled on Friday and no symptoms, I would keep your appointment if possible, as long as your institution allows you to come, which they will. Should I get my pneumonia vaccine? They are still, at this point, the CDC is saying that any kind of like routine vaccinations that you're due for, you should continue to get. You will want to specifically talk to your healthcare provider about your specific case, whether or not that's something that is important to do. So I would ask, it's kind of a personal, like person-to-person thing. Can you get the virus twice? The CDC doesn't think so. Because like all viruses, once you get it, your immune system actually builds antibodies and memory cells to the virus. And so once you get it, they believe that you are no longer at risk to get the virus again for that reason, because your body will know what to do with it again. And that is pretty true for all bacteria, all bacteria and viruses. Your immune system is a smart thing, and it catalogs the virus and the antibodies that you make to that, so that if you were get exposed to it again, it can get rid of it. Can Zycam nasal swabs help keep the virus from getting in your body? Really, none of that has been proven. There's some crazy things that I've seen, like using a hairdryer on your nostrils, gargling with salt water. There's just a ton of things that actually people are trying to do to prevent the virus from sticking to you. So far, the really only validated thing that folks have noticed is actually drinking water and keeping your mucous membranes nice and wet, so that, they're healthy. While immunotherapy does not compromise the immune system, how can the system react with a fighting virus while receiving treatment? That is a really complicated question. The reason is that your immune system, like what we're asking it to do for your melanoma treatment, is very different from, like, it engages different parts of your immune system. So, like, the same thing applies when you, like, if you were to say, like, I have strep throat, we would still give you your treatment, because your immune system can still do what we're asking it to do with the immunotherapy and still fight the infection of the strep throat. It's because your immune system is extremely complicated, but also very smart. And there's it's like an adaptive part of your immune system and an innate part of your immune system. And they do very different things. And the immunotherapy is activating a different part of your immune system than the treatment is. I know that's not a specific explanation, but it's the best I can do without a whiteboard and like 2 hours. Is there a risk from an overreacting immune system? Yeah. So actually, part of the reason that people get the lung changes that they do in the coronavirus is because your immune system like freaks out and it causes all these inflammatory changes in your lung. So it's not the actual virus that is causing at first the fluid and the inflammation and then eventually the scarring and fibrosis. It's actually your immune system doing that. So yes, there is a possibility of overreaction. It is very unclear at this time as to like if you were develop pneumonitis while on immunotherapy, how that would impact you if you did get infected with the coronavirus. I wish that I had a better answer for that. It's something that they really don't know, because to date there hasn't been anybody that's had that situation that we know of. I do know that there are things that they're trying in European countries with clinical trials using not only things that we use for pneumonitis, but also other antivirals and things like that to kind of help combat that issue. What can we do to boost our immune system? That's actually on the very, very long list of questions that I have that I'm not sure how much of that we're going to get to. We've been talking forever now, but the normal things that you would do to keep yourself healthy: get plenty of rest, make sure that you are eating good foods for you, healthy foods, fruits and vegetables, make sure you're drinking a lot of water. If you can get exercise, it doesn't have to be great exercise. It could be just walking. You're allowed at this point in almost all the states to exercise outside if that's something that you want to do. So what you would generally do to keep yourself healthy in a regular situation applies in this situation as well. My infusions are outpatient in a major hospital. Should I go wearing a mask and using surgical gloves? Again, we really need to save those resources for healthcare providers. So we really need to make sure that we don't use them in places where we don't need to. If you were infected, you should stay home. And that would be the only reason to do those things. If truly you are immunocompromised, you may want to talk to your doctor about maybe not going to your infusion, at least at this point, or wearing a mask. The surgical gloves I don't think are necessary at all. But really that would be a case-by-case basis if you truly are immunocompromised. If you get the virus taking targeted therapy, do you have to stop treatment? That's really a decision that you and your healthcare provider would make together. I can't really answer that question. I'm sorry. You shouldn't be afraid to leave your house, Tina. Really, truly, you just need to protect yourself. But really, you need to not leave your house if you don't have to, because that is how we're preventing the virus from spreading. Like that truly in its definition is social distancing. Okay. Would adjuvant immunotherapy be considered elective? No. That's actually a treatment for adjuvant therapy. So that is not an elective thing. We would like to not interrupt that as much as possible. And really the recommendation, at least at this point, is a very local one between you and your treating healthcare provider. As long as the institution doesn't have any rules about you coming there, it's not an elective thing. You are legitimately on treatment for your stage 3 disease. Oh, my comments went away. There they are. Adrenal insufficiency, that was something that was also on our list. Being on replacement steroid for adrenal insufficiency also does not make you immunocompromised. That's actually a really common misnomer. So it's something that adrenal insufficiency means that you don't have steroid that your body's adrenal glands would make on its own. And all that the supplemental pills like hydrocortisone do is replace something that's missing. So it's just allowing your adrenal glands where there isn't adrenal function to have it. So we're literally just replacing a hormone that is not present. It's a normal non-immunosuppressive dose. So you are not immunocompromised if you're on adrenal insufficiency treatment. Your daughter having, Miranda, if your daughter had a coronavirus 2 years ago, it's definitely a different strand. I will say that they're finding that kids do really, really well with this virus. There actually is an extremely low, if not non-existent, mortality rate in children. So while it doesn't protect her against having this particular virus, having a prior coronavirus does not make her protected from this. Kids really do well. So you should not worry. Trying so hard to get through these questions. Bear with me. Tracy, the whole question about am I at increased risk for cytokine storm with immunotherapy if you are infected with COVID-19? Logic would tell you possibly, but they're just not sure. So I'm sorry I can't answer that question. I know that it's important. This virus is so rapidly evolving that we just don't know the answers to some specific things like this right now. All right, so I think I got to most of the things that I didn't talk about in my lecture as far as questions are concerned. And certainly if you do continue to have questions, please continue to post them or call the Ask an Expert line. If it's something that I can answer, I absolutely will. I'm also not afraid to tell you that I don't know. Again, there's a lot of things about this virus that, we're still learning, and information is unfortunately changing all the time. So, we'll do our best. Let me see if there was anything else. Yeah, I think I'm actually going to try very hard now to take you to the bathroom so I can show you how you actually wash your hands. They're saying 20 seconds. I do a hand washing that's actually 30 seconds roughly. So it's a little bit different, but let's try and see if we can take you with us over there. Don't look at my house because it might be dirty. We're just gonna try our best here. All right, so it's a very, very flattering view of my face. Let's try to get the camera set up really quickly. All right, so, whoa. All right, so essentially the first thing that you want to do is wet your hands. You've turned the water on, wet your hands. Put a lot of soap. We have a lot of soap. The first thing I do is get a good lather for 5 seconds, just like this in the middle of your hand. Okay, so then after 5 seconds, then I do the top of one hand for 5 seconds. 5, and then the other one. 1, 2, 3, 4, 5. And then we do between our fingers. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5 to get this place between your thumb. 1, 2, 3, 4, 5. And finally, I just do this where I wring my hands. 1, 2, 3, 4, 5. And then you want to rinse your hands off with your fingers pointing down for at least 5 seconds. With actually hot or cold water, surprise, it doesn't matter. So you're going to wash your hands like that. Try to drip in the sink. And then you want to take a towel and you want to dry as thoroughly as possible because you want to make sure that you don't leave your hands wet. It'll make them really dry. And then I usually use the towel to turn the thing off. I replace my towel a couple times a day if possible, but at least once a day. At work, clearly I'm using paper towels. If you can afford and find paper towels, that truly is the most sanitary way to wash your hands. But really, when you're doing a hand wash, you really need to at least scrub for 20 seconds to be able to kill the virus. So I know that was really not great video quality, but hopefully now you know how to appropriately wash your hands to kill not only the coronavirus, but any other types of bacteria and viruses as well. Really, hand washing is not a new thing. We should be practicing this on a regular basis. There were so many memes on Facebook saying like, I've been washing my hands before it was cool. That's true. You should wash your hands all the time. It definitely will cut down on your family being sick and yourself being sick. So that's all I have right now for our Facebook Live from today. I hope that at least if nothing else, now you're educated and hopefully that brings a lot less panic and a lot less fear because I truly feel that an educated patient is the most beneficial patient because they really know not only why we're doing the things we're doing, but also, you know, how to keep themselves safe. I hope you guys have a wonderful night. Stay in, stay home, do fun things with your family, listen to social distancing. Again, thank you for listening for what is the better part of an hour now. If there's any new things, I will be sure to share with you as much as possible. Have a great night.